Hey everyone. Hey. All right. Well, I this morning I did a press call with a bunch of journalists to talk through all the steps that we were taking to help address the coronavirus outbreak, and I figured it might be good this afternoon to do an Instagram live to talk through with all of you some of the steps that we're taking and answer some questions along the way. Um, So while we're getting started, and while this is ramping and people are tuning in, I just want to start by saying I know that this is a really uh, stressful and challenging time for a lot of people around the world, especially in the community in Italy right now, and in France, and a lot of places across Europe, South Korea, a lot of places in Eastern Asia, and I think everyone around the world is thinking about all of you, and some of the stories that we're seeing about how people are pulling together is are really inspiring. Hey Gary, how's it going? Things are going okay. All things considered. Family is healthy. I'm healthy. That's what we're focused on at home right now. On the Facebook side and Instagram side and WhatsApp and the work that we're doing, the I see Adam Mosseri, our head of Instagram, tuned in. How's it going, Adam? Good to see you. The At our company, the biggest thing that we're focused on right now is just focused on making sure that people can get access to good, authoritative information. And we've partnered with the WHO, the World Health Organization, the CDC, Centers for Disease Control, and a lot of local governments to make sure that we can get out good authoritative information about what's going on. Now you may have seen at the top of Instagram, we put a link to the CDC. They have a great website, cdc.gov, that it has Q&As on what to do if you're feeling sick. What are tips for prevention? It's quite a good resource, and I think pretty well done. We've done links to the WHO and CDC across Facebook as well. We've basically supplied these health organizations with as many free ad credits across our platforms as they need to get their message out. And today, we're right in the process of launching the Coronavirus Information Hub, or Information Center, which we're going to put at the top of the Facebook app. And that's basically going to take a lot of this authoritative information from the WHO and the daily situation reports that they're putting out, from different folks who are talking about social distancing and why that's important and how to do that, and different questions around that, and updates from local governments about what's going on in different places, and how to stay safe and not only keep yourself safe, but your family and your community as well. While we're working on that, we're also very focused on preventing misinformation from spreading across the platforms. We're working in partnership with the WHO. They've basically provided us with a list of claims, that things that people are saying that might be encouraging people, if they're sick, not to go get treatment, and we're taking that down. We don't want people to be out there trying to sell false cures for things, or encourage people to do things that are going to put them in harm's way. We're also seeing overall that in times of crisis and disaster like this, especially when people can't be together with their friends and family, people rely on social and communication services a lot more. We're seeing a lot of people use these services, use Instagram and Facebook and WhatsApp in new ways across the world. I mean, in Italy, we're seeing the Pope now hold his mass, daily mass, over Facebook Live, because people, of course, can't come together to pray and want that connection. a lot of the firsthand reports that we're seeing, there's a lot of people. There's a doctor in Italy who basically goes on live every day after she's done in the hospital and gives a readout of what she's seen in the hospital that day. And I think it's kind of accounts like that, in addition to just the numbers and the stats of what people are sharing, that I think give the outbreak some more color, and help people really have a sense of what is going on at a human level, beyond just looking at some numbers increase. So there's a lot of use like that, and a lot of our focus right now, honestly, is just trying to make sure that the services stay up, and can continue to flex with that, with all this increased usage. We're seeing video calling and lives like this are double the normal amount of usage or more. Some types of calling, group video chats, I think we're seeing are up like 5x or something ridiculous like that. Because in times like this, especially when people can't be together in person, they really want to use these services to be able to stay to be able to stay connected. And I don't think we're the only ones who are seeing that. My understanding is that a lot of the internet infrastructure is coming under a lot of pressure right now, especially with a lot of people staying home, sharing videos, watching videos. So this is something that we're going to need to really work on over the next few weeks, is just making sure that everything stays efficient, and that basically that the networks can stay running smoothly while everyone is relying on them to stay connected to the people who they care about. All right. Well, in addition to this being a big health issue, we're also very focused on this as an economic issue. Small businesses, I think, are going to be under a lot of stress, as a lot of people around the world don't want to go out to restaurants and different places like that. And we really want to do what we can to help the recovery there. So we announced yesterday a program where it's a $100 million grants program for small businesses, where it's about 30,000 businesses around the world in cities where Facebook employees live and work. It can apply for grants, and small businesses are really important, not just for people's jobs. but they're critical as parts of the community. They often hold local communities together. They're places where we go to hang out, get together with friends when we can go out and do that. And it's just really important for the stability of our society and economy that they can continue doing well and can get through this and recover quickly. So we're working to do what we can on that. There are a few other things that I want to go through, just in terms of how we're making sure that our workforce stays safe. But I also want to see if there's anyone on this thread who has any questions, and I'm happy to take a few questions before wrapping up here. On the workforce side, the big thing that we did before, even before the governments gave the orders that they wanted people to slow down people coming into work, to slow the spread of the virus, and we recommended globally that pretty much all of our employees, except for some critical staff who run the data centers and are involved in safety and security and in some key things like that, we recommended that all those folks work from home. And it's really important. I want to give a plug for this, which is that especially across the U.S., across all places in Western Europe, I think the official guidance from governments at this point is that you should stay home. And basically, this is really important to stop and to slow the spread of the coronavirus, because the bad outcome here for public health is if a lot of people get this at once, and the hospital system gets overrun, and that ends up leading to much worse health outcomes, both for people who are in there who are sick with coronavirus, but also people who are in for other sicknesses or normal things that they would have gone to the hospital for. So it's we really need to make sure that we're doing everything that we can to slow the spread and reduce the peak of the hospital load and that will help make sure that that basically the health outcomes remain as good as possible for everyone across the world. I'm reading some of the comments and seeing if there are any questions here. Mostly emojis. All right, can you tell us a bit more about the small business support plan? As a small business, we heavily use Facebook and Instagram, so we're happy to hear that there may be something for small businesses like us. Yeah, so we announced this plan. It's a $100 million program to give grants to small businesses around the world, and especially in cities that our employees live and work. And the idea is just to fund help with the recovery, right? So part of it is grants that you can use for whatever is useful for your business. Part of it is tools in order to be able to use the internet and our tools to be able to attract and reach new customers and speak to the customers that you already have to make sure that that you can keep on growing, even if there's an economic downturn. And so I posted about this yesterday on Facebook, and the link is in the post that I put there. But if you want to apply for the program, we're going to basically be funding 30,000 small businesses in a number of cities around the world. So it sounds like if you're running a small business, then you're the type of folks who we have in mind for this. And we want to make sure that we can do our part to support small businesses and growing and kind of staying this base of support for the economy in our local communities. All right, what else is going on? How do we participate? All right, Joshua, what constitutes a small business? I don't, off the top of my head, know the exact criteria, but it'll be on that website with the link that I talked about before on my Facebook page. I mean, I think if I think unless you're running like a large enterprise, I mean, you're probably in the range that we're talking about from this. I mean, we're not just talking about little shops that only have a couple of people. I mean, you can have a business that might have 50 employees or 100 employees and still be a small business. So so check out that link and apply if you think it's something that could be useful for you. All right, let's see. What is the latest research on COVID? So I guess one thing that I didn't talk about before, I was mostly talking about the Facebook response, but we're working on this a bunch through our family's philanthropy, the Chan Zuckerberg Initiative too, that I do with my wife Priscilla, and so we have somewhat of a lens into the health system and science there, because a lot of the Chan Zuckerberg Initiative's work is on science, with this emphasis on, it's a long-term project, but the goal is to help scientists cure, prevent, or be able to just manage all diseases by the end of the century. It's ambitious, but I do think that science is making a lot of progress, and it is possible over the next many decades. So what we see here, we're doing a number of things. One is we're working a lot on just increasing the testing capacity for coronavirus, especially here in the Bay Area around our home. We're 4xing the capacity of the local hospital at UCSF. It's a great hospital and university, and they're doing great work to make sure that that they can increase the capacity of testing, and that's obviously an important part of the response here. Another part of what we do is, we have this project that we call the Human Cell Atlas, and the idea is it's kind of like, when you study chemistry, like the first thing that you learn is the periodic table of elements. That's kind of the roadmap of all the different pieces and the different types of elements and how the different states they can be in, how they interact with each other. And we don't have anything like that in biology yet. Right? We don't have a periodic table of elements for all the different types of cells in your body and the different states they can be in. So that's what this project, the Human Cell Atlas, is trying to do. And part of that is there's a subpart, the Lung Atlas, which basically a bunch of scientists who we work with are putting together this inventory of all the different cell types in the lung and the different states that they can be in. And we make sure that all this research is published openly, right? So that way any scientist can read it. It's published on this preprint program server called bioRxiv. So that way, while it's getting reviewed by the scientific community, you can just put it out there and people can check it out. And a bunch of researchers have looked at basically some of this data on the different cell types in the lung and how different other drugs have reacted with them in the past, and now have a bunch of different ideas for possible therapeutics that could help reduce some of the symptoms of coronavirus. And if that's possible, then a lot of the long-term damage or fatality that we're seeing comes from reaction in the lungs. And if there's a way to reduce the symptoms there and the severity of that would just be a very big deal. Now, none of this is going to be ready like today or even in the coming weeks or months. But if it's possible to take existing compounds that have been approved for helping to fight other types of diseases, so they've already been certified as safe for people to take, and if we find that they can be effective here to address coronavirus, then that could be a pretty big step forward and something that we're pretty excited about exploring and trying to enable scientists to do at CZI. All right, well, let's see. What other questions are there here? All right, so there's a bunch of questions about misinformation and what we're doing to basically to prevent misinformation from spreading. And here, a big part of what we're doing is we've partnered with the WHO, the World Health Organization, who has given us a list of basically claims that they've debunked as false. Right, so they range from things like, if you have these symptoms, don't worry about getting treated because you're probably fine, even if that might mean that you're sick and you could be saved and recover if you do go seek treatment. We obviously don't want to be discouraging people to get treated if it would help them. And some of the stuff is just kind of trying to convince people of false cures. Some is really ridiculous. I mean, the most ridiculous example I think that I've seen is one saying that if you think you have coronavirus, you can drink bleach and that will cure you, which obviously it will not. And not only will it not, but that's obviously extremely dangerous and something that no one should be doing. So we want to make sure that we take that kind of misinformation down, anything that's going to put people in imminent risk of harm. And we work with the WHO. It's a trusted organization that basically can give us a list of these debunked claims so we can operationalize that and go out and find them and try to take that down. All right, let's see. There's a question, are we working on this kind of research too? Well, so at the Chan Zuckerberg Initiative, at our philanthropy, well, we try to build tools to enable scientists. I kind of feel like the gifts that and kind of talent that I can skills that we can bring to the table are around, ability to do software engineering and build things. And of course, from the success with Facebook, we have a lot of capital. So we wanted to try to build a philanthropic organization that invests in building new kinds of tools that then can enable scientists to see things in new ways and be able to cure diseases and find breakthroughs better and faster than they would have without the tools that we could build. So the examples through the history of science are that typically whenever a new type of tool gets developed that helps you see something in a new way, like a microscope that lets you look at bacteria or cells, people then understand that thing a lot better, and they're better able to fix issues with it. So that's more of what we're trying to do here. We're trying to build tools that the scientific community can use. The Human Cell Atlas is one program like that I mentioned. Another is, we have built this tool called ID-Seq. It's called an infectious disease sequencing. And what it basically does is you can take a sample of blood or from someone, and basically it'll tell you, you can sequence what exactly a disease is, and what it is, what it's related to, and that'll give you a sense of what a person might have, as well as how you might go about treating that specific disease. So now we've partnered with the Gates Foundation to deploy ID-Seq in a number of places, especially in Asia, to help understand the spread of the disease and help scientists. And there's a lot more that I think we can do there. But that's the kind of tool that we're very focused on building. All right, so let's see what else is here. I'll maybe take a few more, and then I will sign off. All right. eBay has banned the sale of masks to stop price gouging. Are we going to do that too? We actually do. We have a policy against selling masks through Facebook ads, and it's a relatively new policy because this is a relatively new health crisis. So we're still getting better and better at enforcing it, but that policy is in place, and we're definitely working on that and trying to do that. Let's see. All right, maybe one more. I mean, there's a lot of health questions or public health questions that, frankly, I'm just not the right person to try to opine on them. I mean, people are asking things like, when will the pandemic end, and how can when are we going to be able to go back to work? And frankly, I mean, that's really, those are not things that I know the answer to. When will the pandemic end? I think, fortunately, at this point, I think governments across the world are taking it a lot more seriously and taking a lot of good steps, both on the health side and starting as well on the economic side, to try to alleviate some of the pain that's coming from this and reduce the spread. But I guess, as one kind of closing thought on this, is I do think to a large degree, how this spreads will somewhat depend on how well we all do at respecting the guidance around social distancing and staying at home. I know a lot of people think that doesn't apply to them, or that they're not at risk. But the reality is that we're not just doing this for ourselves. We're doing this because there are other people in our communities who are more vulnerable, and by staying at home, we're reducing the likelihood that we get exposed and therefore can pass it along to someone else. And I mean, I've read some of the firsthand accounts of kind of people who have it, who have the disease, or doctors and medical professionals who are treating people. It does not sound like an ordinary flu. I think it sounds like it can be significantly more severe. So I just really encourage everyone to follow the guidance from your local governments on this. I mean, I know on this live stream there are people from all over the world, so it's not just one government whose guidance I'm suggesting that you follow, but around the world, especially in the U.S. and in Western Europe and a lot of other places, the guidance at this point is please stay at home, be careful, do it not only to kind of keep yourself and your family safe, but do it to keep the whole community safe. And I think that's a really important thing. And I guess just one final thought before signing off here is I just want to give a shout out and acknowledge all of the health workers who are on the front lines fighting this. Some of the accounts that I've heard are, it's scary, but you guys are all just doing absolutely heroic work and, putting yourselves often in harm's way in order to do what's necessary to keep your community and the people around you safe. And at the end of the day, I think the efforts that you're all making are going to be a large part of why we will ultimately prevail and slow the spread. So I'm really personally grateful for this, and I can't thank you enough for the work that you're doing. So, all right, well, thank you all for tuning in for this live stream. If it's useful, maybe I'll do it again soon when we have other updates. In the meantime, I encourage you to check out the Coronavirus Information Center that we're launching shortly. It'll have good authoritative information from health sources around the world, and ways for the communities to come together and help each other. And other than that, stay safe, and I will see you soon.